This is Keisha's second speech. Okay. Before I start, I'm going to introduce my audience. My sister Tamika, my sister-in-law Shaman, the twins, my daughter Alicia, my daughter Janera, Anisha Tara, and my husband Thomas. Okay, by a show of hands, how many of you all know someone who's a diabetic? Okay. About 6 years ago, I lost my grandmother and my uncle to this disease. My grandmother, she lost one of her legs, and by the time she was about to lose her second leg, she passed away. She had gave up. Before I get into my speech and let you know a little bit more about the disease, I want to show you a video.
The pancreas, located behind the stomach, is involved in the body's ability to use glucose. Within the pancreas, tiny structures called islets of Langerhans secrete hormones into the blood. These islets are composed of several cell types. One cell type, beta cells, release insulin after every meal. Insulin, along with glucose, passes into the bloodstream and travels throughout the entire body. Insulin binds to specific receptors located on cells. The binding prompts the opening of glucose gates, allowing glucose to enter the cell. Diabetes is a disease in which the body has trouble using glucose. In type 1 diabetes, the beta cells are no longer able to produce insulin. In type 2 diabetes, insulin is produced and binds with the cell's receptors. However, when insulin binds with the receptor, the glucose gates fail to open, preventing the entry of glucose into the cell.
Okay, according to the CDC, this the number of people with this disease has increased to 24 million. Also, it has been a 3 million increase every 2 years. I provided a graph showing in Virginia how every couple of years the percentage that goes up, as well as a map down here showing you the United States. And if you can see on the map for my audience, that in the southeast is the more highest rated for people who's has this disease. Okay, today I would like to talk to you about type 1 and type 2 diabetes. First, I'm going to tell you about the symptoms. I have a picture showing you the different symptoms that you can have with this disease, and that include excessive thirst and appetite, increased urination, usual weight loss or gain, fatigue, nausea, blurred vision. In a woman, they have frequent vaginal infection. In men and women, they have yeast infection, as well as dry mouth, slow healing sores or cuts, itching skin, and numbness or tingling of the hands or feet. Okay, now that I've shared with you some of the symptoms of diabetes, let me tell you about some of the complications that are included with this. Type 1 and type 2 has the same complications. I have a picture showing all the different complications you can have, as well as how the feet will look if it's infected. You have high blood sugars, increased ketones in your urine, low blood sugars, cardiovascular disease, nerve damage, kidney damage, eye damage, foot damage, skin and mouth conditions, and bone and joint problems. Okay. Okay, it's very important to know the different types of treatments that are available today. According to the Midline Plus treatment, can vary for type 1 and type 2. The treatments are doing your blood pressure and knowing your cholesterol levels, as well as self-testing of your blood sugar using a glucometer machine. I do have a picture up there showing the glucometer machine. Um, Going to learn different educational information about the disease, as well as exercise on a regular basis, which could be somewhere between 3 to 4 times a week. Foot care, meal planning and weight control, medication or your insulin. There's 3 different types of insulins, but your doctor will let you know which one is best for you depending on the times that you need it. Another important fact, the American Diabetic Association recommends keeping a blood sugar level in the range of 80 to 120 before meals and 100 to 140 at bedtimes. This disease can affect just about anybody. It does not matter about your size. Weight is a factor for it, but not everybody that has a lot of weight on them will have this disease. You could be skinny and have this disease. Type 1 is mainly for juveniles, and type 2 is mainly for adults. In conclusion, the most important fact you need to remember about diabetes is to see your doctor on a regular basis to determine if you are at high risk for this disease. Now that I explained some symptoms, complications, and treatments of this disease, I hope that everyone can benefit from the information that was provided. I hope you enjoy and learn a little more about this disease. And thank you for your time and your attention. This is Keisha Edmonds with her CST100, her second speech.